My name is Zeman Sao, and thank you so much for everyone for joining today. Just a recap, the Center for Economic Opportunity and Belonging has the privilege of joining the Governor's Office of Economic Opportunity and his Office for Immigrant Integration as a part of the New Americans Task Force. Our mission is to engage communities of color to catalyze private, public, and philanthropic partnerships to close opportunity gaps in economic opportunity, education, healthcare, and housing in the state of Utah. As you can tell, the New Americans Task Force aligns really well with the work we do, and we are committed to continue to do this partnership with the Governor's Office and its Center for Immigration Integration. I'm here to just share with you a little bit about updates on the New Americans Task Force and some of the great initiatives that will be coming up shortly. The first I want to share is a program called the Utah Cohort Skilled Immigrants Integration Program. This program will be leading by it's a partnership with the World Education Services. The Immigration Center and the CEOB will be leading on a Utah cohort for the 2023 and 24 Skilled Immigrant Integration Program. The focus of this year's cohort will be on employer engagement with new American populations. More information will come regarding to the SIP program and how you can participate. Secondly, I want to share with you about the USCIS Citizenship Innovation. Congratulations to Natalie and her team at the Immigration Center, which is a recipient of the newest grant from USCIS. We will be partnering with them to build up technical assistance and resources for citizenship preparation services outside of Salt Lake County area, and more information to come on that as well. We're excited to be able to provide this resource and be able to advance citizenship in the state of Utah beyond just the Wasatch Front. And lastly, just an update about the survey on internationally trained professionals. We're just wrapping up research on that and are planning a release event in November. Invitation will be sent out shortly to individuals, and also the release of the report. We're really super excited. It's been a long time coming for this report, and thank you for all of you who have contributed to that. And with that, I'll turn it back to Natalie.
Great. Thank you, Z. Just also wanted to highlight a few different events that are coming up related to New Americans in Utah. The Froggeman Law Firm, which is an immigration law firm that has an office here in Utah, will be hosting a free citizenship clinic that will be up in Ogden. It's on Saturday. So this Saturday, not a lot of time, but make sure you scan that QR code, and we'll also share the information in a follow-up email. But there, as we know, that there's over 50,000 people who are eligible to apply for citizenship in the state of Utah. And so we're really hoping to get some citizenship resources around the state to ensure that people have a pathway to that. So this is free legal assistance to apply for citizenship, get their citizenship applications ready to submit, or at the very least get a consultation on where you're at with your citizenship potential to apply, or what resources you would need to do so. The next resource that we have is around Salt Lake County. They'll be hosting a fall community resource event in a couple weeks here. That's really targeting Spanish-speaking communities, really trying to highlight the different resources that are available to individuals, especially newcomers who are arriving here in the Salt Lake County area. So this will be done in partnership with the Consulado de Colombia and the Alliance Community Resources Center, who provide legal assistance, of course, Salt Lake County and Utah Health Plans. So a really good resource to be aware of, to please share. And then the last resource that we wanted to highlight, because we know immigration legal assistance is a high need, is that Salt Lake Community College is hosting an immigration help center in October and November. And so this is a great opportunity to go in and to get some assistance on legal cases. We know that work authorization is a big need among some of the new arrival populations. So please share this widely with any of the new arrivals that you're working with. They can go and get a consultation as to whether they can apply for an EAD, how they apply for asylum, how to adjust their status or to apply for U.S. citizenship. It's a really great opportunity to utilize some of the free resources that are available, so people have clear understanding of what their next steps are in their immigration journey. So thank you for kind of sharing these out within your communities to make sure folks know about some of the resources that are here. If you have resources that you would like for us to uplift with the New Americans Task Force, please send them to us. We're happy to share them out in our communications and to lift them up, regardless of where they're at in the state. I know a lot of our work is kind of centralized up here in the Wasatch Front, but we have people from all over the state who join. So please feel free to share with us any resources, or if you're interested in learning more about these resources and how you might bring them to your community, we can certainly help with that. So now the next piece of our agenda here is to really dig in to some of these opportunities that exist with Talent Ready Utah, with Intermountain Health, and with IsoMed. So as we know, in Utah, there are over 270,000 foreign-born individuals who call Utah their home, and that number is growing. So while we look to our growing workforce demands, recognizing the important role that New Americans play in contributing to our most in-demand businesses, their contributions as employees and community members, and of course, for many people, the education, skills, talent, and work ethic that people bring with them. However, to recruit and retain New American populations, employers really need to be ready to embrace a multilingual workforce and offer professional development to help them succeed. So I'm really pleased to bring together these three organizations to share a little bit more about the pathways that they've built and some of the opportunities that exist around the healthcare sector. So we'll start off with a presentation from Samantha Aird from Talent Ready Utah to give us a little bit more information there. So Samantha, feel free to share your screen if you have a slide deck, and we'll hand the time over to you.
Excellent. Thank you so much, Natalie. I am so excited to be here and present to everyone. Sorry, let me just grab something real quick here. My name is Samantha Aird. I'm with Talent Ready Utah. Talent Ready Utah is an organization that was legislatively created. Did I freeze? No, I'm back. Okay.
Yeah. Are you sharing your screen?
Yes, sorry. Still working on pulling up that presentation. I got my wires crossed on that. So sorry. Well, that's not going to work right now. That's fun. All right. Let me try one more thing. While I'm pulling that up. Talent Ready Utah is housed in the Utah System of Higher Education, in the Commissioner's Office of Higher Education. And what we really do is we are a convener. We bring together industry, education, and legislation in order to fill holes in the workforce. As a program specialist for this program, I help with the administration. Here we go. I help with the administration of all of our higher education grant programs. And specifically, I am over the Return to Work program. So when you hear from Mandy, a lot of what we are doing, we're doing together, which is really, really exciting. And I'm so sorry, one more second, and we'll be there almost. You'd think I'd know how to do this better. See. Oh, I'm sharing the wrong one. I apologize. That's good. Okay, there it is. Sorry, everyone. So the two programs that I want to start off talking about are the Talent Ready Connections grant and the Utah Works grant. So Talent Ready Connections is a collaboration between an education partner. It doesn't have to be a higher education partner. It can be a secondary, but it does have to be a public education entity and an industry partner. And within that, the focus of the Talent Ready Connections program is work-based learning. So within work-based learning, the emphasis obviously is getting individuals back into the workforce or into the workforce for the first time with those, man, I am just rocking it today, you guys. I apologize.
You're good. We can see the presentation just fine.
That's good, but it's also showing the notes on my side. So I
couldn't see it on our side. You're all good. Yeah.
Okay. Let me try that one more time. Okay. Man, live. Anyway, so with the Talent Ready Connections program, the application period, as with all of our grants, is going to be April, July, and October. So we've just finished the most recent review cycle, or closed the most recent review cycle, and now we're going to be working on processing those applications. The next one we'll take is in April. Utah Works is one of our programs that has one of the most applicable workforce connection to new Americans. This is a pre-employment program or a recently employed program. So individuals can participate in these programs tuition free through an education partner. And the curriculum for those programs is specifically designed either around a specific industry partner or a consortium of industry partners. The benefit to individuals participating in these programs is that upon completion, individuals are eligible to be guaranteed an interview with one of the partners. So that's the huge benefit to these Utah Works programs. As an industry partner, you're guaranteed an individual that is highly trained. And on an individual perspective, you're guaranteed at least an interview for a qualifying position. And for the new enrollment, for the recently hired enrollment, as an industry partner, you can design curriculum based around exactly what you need for a position. A perfect example is Albany. They needed mechanical technicians. So what they do is individuals show up on day 1 to Albany, they fill out all their HR paperwork, and then from day 2 to week 6, they are at Albany learning how to be mechanical technicians. At the end of that 6 weeks, they go right back onto the floor at Albany, and they're fully trained technicians. And you'll see in some of the later slides, a couple of the programs that we've utilized for Utah Works that involve new Americans. Now for the Return to Work program, which I'm specifically over for the state, the Return to Work program originated from the success in the Lieutenant Governor's office of her Return Utah program. So if you've heard of the Return Utah program, that was from the Lieutenant Governor's office specifically for state positions. And it was so successful that she utilized that success to fund the Return to Work program through House Bill 333 in 2022. So it is separate from the Return Utah program. It's fully administered by Talent Ready Utah, and it is focused on the private sector. The objective, the oversight for the Return to Work program is to create and expand programs for individuals that are re-entering the workforce. So now you can understand how this applies to our new American populations. These are individuals who have worked in related industries, or perhaps not related, but they've taken a break in working for whatever reason. Traditionally, you'll see these programs focusing on returning parents. But in the state of Utah, the legislation was intentionally left vague so that we could contact and connect with other communities like new Americans. As I mentioned, this is a private sector focused initiative. So the funding does actually go to the private industry participant. So it doesn't go to an education partner like a lot of our other initiatives at Talent Ready Utah go towards. The focus of these Return to Work programs is 3 pillars. It's on reintegration of individuals back into the workforce after a break. It's a focus on mentoring. So individuals develop the skills that they need to remain in the workforce and to upskill anything that they may have created a lag in since they've taken that break. And it's about employment mobility. At Talent Ready Utah, we deal with 4- and 5-star jobs. So these are high wage, high impact positions. So we want individuals to be able to make that living wage, and we want them to be able to have career mobility. You will obviously hear more from Mandy about the Intermountain Healthcare Return to Work program, but they were awarded that this last summer. And that is focused on new Americans. And I'm really excited for her to talk about all the details of that program. But of the other approved programs, we work with justice involved individuals, new Americans, returning parents, all of that. And as you can see, there is a very large Return to Work program that is under review currently that will involve new Americans, and that is in advanced manufacturing. So we work with all of the different industry sectors across the state with as many different communities as we can. For the other Talent Ready Utah programs, we do have a program that was called Learn and Work. It was sunsetted. It was brought out from COVID funding. But within that, through the University of Utah and Southwest Technical College, we were able to fund several ESL programs in different industries. And currently, under the Utah Works program, there are 2 programs that are funded just for new Americans focused on that ESL. One in, as you can see, nursing assistant through Salt Lake Community College, and also another for CDL and ESL through Salt Lake Community College. So just to kind of give you an idea of the breadth of programs that we offer and how we can help individuals and industry partners along with those education institutions. So that is what I have for presentation. Are there any questions?
For questions, you can feel free to raise your hand, type it in the chat, or put it into the Q&A. We're monitoring all 3 channels there. I think one thing that I'm really excited about with the initiatives that Talent Ready Utah is, in general, they're just really innovative and really bridging industry with resources that are available in the community, or building the resources where they don't exist, but also the prioritization or considering new Americans as a population that deserves pathways right into some of the Talent Ready programs that exist. So if you're associated in this group with an industry, an association, a corporation, or a business, and you think that there might be an opportunity to kind of explore some of these opportunities with Talent Ready Utah, you can feel free to reach out to Sam or to me, and so we can brainstorm around what some of those potential is there, which is what we've done here with Intermountain Health and with around advanced manufacturing as well. So lots of good things that are happening there. Are there any questions from folks before we move on? And there might be more as we're going along. So feel free to put them in the chat or raise your hand.
And I will put my email in chat as well if a question comes up in the meantime.
Okay, great. Well, with that, we'll turn it over to our next presenter, Mandy, and we'll give you a second to get your slide deck up. Mandy is with Intermountain Health and is going to share about a new return program that was just recently funded from Talent Ready Utah, and also about other apprenticeship opportunities at Intermountain. So, Mandy.
Thanks so much, Natalie, and appreciate the invite and opportunity to share today. If you could just give me a thumbs up that I'm sharing a full white screen with my slide deck, that would be great. And you're not seeing my notes screen, right? I think I hit share. This is the problem for those of us who are not typically Zoom users. When we come to a Zoom meeting, it's always just problematic, and we're always new learners all the time too. So, Natalie, thank you for providing an opportunity to share about this program. Sam, thank you so much, as always, for your cooperation and feedback and guidance as we went through this application process for the grant. We're very thrilled recipients, and I'd like to give a little bit of an overview of the area of my work, which is a formal apprenticeships at the organization. I think they provide an incredible pathway to healthcare careers. And it's an accessible pathway with the only minimum requirement being a GED or high school diploma or equivalent needed to get into these programs. So really great pathway. And then this model has really proved to be the foundation for this return to work proposal that we had put forth. So I'll start sharing a little bit more about the work, and it'll feed right into the grant receipt. So we launched a formal registered Intermountain apprenticeships in 2021 in December of that year. They were really implemented to provide us with a key pipeline strategy for some really critical specific roles across the organization. What it has done is it's provided us an opportunity to source diverse and skilled talent. We're able to look into areas of our community that we traditionally don't source talent from, or who may not traditionally apply for jobs in healthcare for whatever reasons. So that's really provide an access point into healthcare with the opportunity to grow, advance, and be mobile in your careers. We're looking at this as on-the-job training in a complete earn and learn model. A lot of the registered apprenticeship programs out there today pay for your didactic education, so kind of your classroom or your online portion of your training, but they don't really compensate you as a full-time employee until you get to your on-the-job training. So with Intermountain's programs, we found incredible value to start paying in an earn and learn model from day one. So even if an individual is sitting in a classroom learning, or if they're sitting on a computer learning, we are compensating that individual as a full-time benefited employee. And that what that's done is it's really provided that apprentice to kind of work on the job, to really consider the apprenticeship their job, and then to also mirror what their work schedule will look like after they're completed their apprenticeship. And then we're providing some financial stability, financial opportunity, and also some benefits that go with it. So apprentices are allocated every single benefit that Intermountain employees have. At the end of our apprenticeships, there's a portable credential. This will be a nationally recognized credential in the field that they are studying for their apprenticeship program. And what that does is it allows that individual to take that credential with them. So at any point, if they need to leave Intermountain as their place of employment, if they need to move for whatever reason, they have that credential. So that's important. It goes with them and they're able to use it to apply for their next job. This gives you a little bit of an overview of the programs we currently have in place: digital technology or IT, cybersecurity, clinical engineering. These are biomedical technicians. So those are the individuals that go into the OR space or the clinic space or some of these inpatient rooms and fix all the equipment. That's so vital and crucial. We have a medical assistant program and an OR tech program as well that just started up in the Salt Lake Valley. We have several partners. We have some great metrics in place to diversify our talent pipeline. And then we also have a lot of ROI already that we're seeing brought in from these programs. And I'll share a little bit about that in just a moment. We've had a really great opportunity to be kind of spotlighted in local and national press, which has just been wonderful because it brings the opportunity to the forefront of our community members. So community members become more aware of the opportunities available when we can kind of publicly recognize what's been going on. I spoke a little bit about this. This is our process for apprenticeship at the system level. We have apprentices hired into that eligible role from day one where they're earning and learning. They have on-the-job training. The hours correlate with the minimum number of hours that are required by the Department of Labor standards. They earn that national portable credential, and then upon completion, they're hired into a permanent role in their field when they're finished. Here's a little bit more of an overview, and I've provided the slides. So Claudia, I hope we get to send these out afterwards to the group, and you'll be able to read through these, but it gives a little bit more detail. So if you're interested in how to partner, how to work with intermediaries, you can definitely reach out to me, and I have some information on these slides as well. So the return to work grant that we received is really based on a program that we have titled 90-Day MA. And the title is a little bit misleading. People think, oh my gosh, 90 days to become an MA, that's phenomenal. How did you do that? So it's a little misleading. It's 90 days of didactic and simulated lab experience, followed by 1,200 hours of on-the-job training. And that on-the-job training happens in specific clinical rotations throughout the Intermountain Medical Group ambulatory clinics. So think the clinic spaces where you go see your doctors, there's specialty practices like neurology, but these apprentices go through clinical rotations at all these specialty practices. So they have a very robust training. And at the end, they sit for their national credential, their CCMA examination. So really that's the culmination of kind of all their hard work. The really wonderful part and the connection to the CCMA credential is Intermountain has developed a medical assistant career ladder. The initial kind of first rung in that career ladder is you can enter the MA field without any prior healthcare connections or experience. And the second tier of that MA career ladder, the second rung, really the individual has to have that national credential. So once these apprentices finish, they're actually entering into that second tier of the career ladder, which allows them to have some increased wage opportunity and growth from the get-go. We started this program in Nevada. We will soon expand it to our Canyons region, which is basically Utah and a little bit of Idaho. So it's coming to the Salt Lake Valley in Q1 of 2024. This is where we will play into this grant opportunity. We decided to implement it across all of the Intermountain regions, which now include Colorado and Montana, Nevada, Idaho. And so really what we've done is we've seen some great results from this program. We are committed to serving our communities. That's part of the Intermountain mission, part of our values. And so we've really been able to kind of offer opportunity for employment to our community members in Las Vegas. We have some great demographics that we're serving within the community. We truly want our caregiver or employee population to mirror our communities. We know that we have better patient outcomes when you receive care from an employee or caregiver that looks like you and that has shared experience. So that's one of the reasons why we're targeting a very diverse workforce, as we want to mirror what our community demographics are. And then by March 2024, we will have 44 medical assistants in our talent pipeline. Medical assistants are in dire need across all of our regions and on a national level as well. Within the Salt Lake geography, we have about 77 vacancies right now, and we are not able to fill those. And so through these types of programs, this is how we're creating our own workforce, as we're training our own. And this just gives you a little bit of an example of our pipeline development in our Nevada, specifically Las Vegas region. We've had 5 cohorts now. We actually have a 6th that has started and a 7th that will onboard later this year. We are monitoring conversion rates and retention rates. We will also be monitoring promotion rates and growth and mobility, and how these individuals use our employee resources, and if those contribute to their career growth and success more long-term. So that's some of those metrics we'll be measuring too with this return to work program. We really want to validate that our model works. And if not, we have a mindset of continuous improvement at Intermountain, and we're always implementing change. Some of this change is reflected through increased conversion rates and some of these retention rates. At the beginning of this program, our apprentices were not compensated. So they were sitting in a classroom from 8 to 5, Monday through Friday, and not being compensated. So granted, their training was paid for, but they had no financial income. And so a lot of our apprentices were actually working in the evenings, sometimes 2 and 3 jobs, to make ends meet and to provide support for their families. One of the things we did do in cohort 4 was we initiated or implemented this as a full-time job. So that way we're hoping to demonstrate more conversion. We're hoping to demonstrate longer retention rates, which then also contribute to some of the ROI that we're looking at, which is less turnover and less vacancy rates, which is a cost to the system and the business. So those are some of the same metrics we'll be measuring with the program that we will be initiating with the New American Task Force. And I'll just dive in a little bit to this return to work program that we developed from this MA medical assistant apprenticeship model. It'll be a full-time paid training opportunity with a comprehensive benefits package. So that's the same type of opportunity that every one of the Intermountain employees or caregivers receives. It'll be a combination of didactic education and on-the-job training. One of the things Sam alluded to, and I'm so glad he did, Sam, was the mentorship component. We've known for years that mentorship is incredibly important and plays a really critical and vital role to the success of an individual. We have a formal mentorship program at Intermountain that's been going for a couple years now, and it's actually implemented through our employee record system and management system. And so we use Workday at Intermountain. And so caregivers who want to become mentors or who want to be mentored log into the system, and they can actually select some parameters to be connected to a mentor that suits their needs. We also have employer resource groups, or ERGs. We have an employee assistance program, which has some incredible benefits. One of the things we're very proud at Intermountain is our education benefits. So through this return to work program, we will have continued English language training so that these individuals can come into the workforce and feel very comfortable using the English language in a clinical setting. We know that there is conversational English that is great, but we know that in the clinical setting, especially when you're conversing on a regular basis with advanced practice providers, nurses, physicians, there needs to be a certain level of medical terminology attained. So we will have continued access to that language training. And then again, those benefits, Intermountain offers upfront tuition payment of up to $5,200 per year, and also tuition reimbursement of the same amount. So we offer an online portal that is supported by InStride, and InStride is the organization that kind of vets or allows us to have access to a lot of the training opportunities that contribute to a bachelor's degree, a master's degree, a PhD. We also have certifications there and stackable credentials. So this allows the individual coming into this return to work program not only immediate training in a clinical facing role, but also access to continued education and different types of pathways so they can have some real opportunity for career mobility, career growth, and with that income growth as well. One of the things we're really proud of at Intermountain is that we are working to have a pathway to employed or to a pathway to roles that meet kind of the living wage. And so that's a really important factor for us. And we want to identify at what point individuals will get to that living wage and how long it will take to get there based on kind of the credentialing system that they're looking at. So through this program, we will have 9 available positions for 2024. Again, it will be an opportunity to gain your national CCMA, your medical assistant certification and credentialing. This is a really quick pathway into healthcare to get your training, on-the-job training, and then credential. So we also understand that a lot of these new Americans have healthcare backgrounds and wanting to get back into the field. And for those who don't have credentials that transfer over, this will be a great way to get back in and get back in quickly. And then, of course, it's an immediate pathway to permanent employment upon completion. So a really great way to get into the field quickly, get credentialed, be working in a space that we desperately need individuals to be working in. I wanted to share briefly about some of the other earn and learn opportunities that we have at Intermountain. We have paid training programs to become a certified nursing assistant, to become a phlebotomist. Once you're in as an Intermountain employee or caregiver, as we refer to all employees, we have training programs to help you become a registered nurse, a surgical technologist. Of course, we have apprenticeship programs. Our surgical tech apprenticeship program is now accepting candidates for our second cohort, which will start in January of 2024. There is a live posting on our external facing careers page. So if anyone is interested, please let me know and I can provide them the direct link. But there will be 15 positions open in this next cohort. It's on-site in-person training at LDS Hospital, and also provides a clinical externship component and provides direct pathway to employment upon completion. So a little bit more information here. Again, we'll send out these slides. And I really just want to take a quick minute to show a little bit of the success demonstrated through our apprenticeship programs. And this is why it is incredibly valuable for us to use a proven model at Intermountain to coincide with this return to work program. We know it works, we know there's success, and we know it's high value for apprentices. So Sarah and Jay were apprentices in our IT program, and you can see immediately this is actually a reflection of their first 3 months of work. So 3 months on the job, there's already incredible success and value add to the organization, and also value add to Jay and Sarah. Jay and Sarah have finished their programs and they're employed full-time at Intermountain in permanent roles. Zamira and Sydney, again, this is also within three months of their apprenticeship initiation. They were working on respective programs. Zamira identifying 40 hours of time savings, which is huge. That's 1 week of work for an individual, which is incredible. And then Sydney as well, making a huge impact through the Milk Group implementation project at McCady Hospital. This is really a lot of words. I don't expect you to read through it all, but apprentices come in all age ranges. I think that's one of the questions we get all the time, is apprenticeship just for a young population? And I think Doran would be okay with me sharing that he is a bit more mature, and he came to apprenticeship kind of as a mid-career change, and really found value coming into this training program model. He came into our cybersecurity program and has since been hired as a cybersecurity associate, so working in a permanent role at Intermountain. And James is one of our members of the first cohort of our 90-day MA program in Nevada. We do a lot of work with former military, former Navy veterans. And so James came to the program through that channel, through our Goodwill program supporters in Southern Las Vegas. James finished his training. He received a CCMA certification on the very first try, as did all of our apprentices. So that's a little hurrah, because it's a very challenging exam. So James received his CCMA on his first try. He's now working in the Intermountain clinics as a medical assistant, and does mentor some more younger, I want to say young, not in age, but more less tenured members of this program, and those in the same role as James. So we've had some wonderful outcomes in the short amount of time that we've had apprenticeship in Intermountain. And I am thrilled that we get to work both with Sam and Natalie in this upcoming year to implement a program targeted specifically toward our new American population, so that we can continue to support community members with wonderful careers in healthcare that offer career advancement, mobility, and then of course that income growth. So Natalie, I'll stop there. And if there are any questions, I'd be happy to take them now or later, and answer them whenever is best.
Thank you, Mandy. That was very informative to help kind of give the big picture of what Intermountain Health is doing around apprenticeships and some of the pathways that exist. And one of the things that we hear so often from people, new Americans who are wanting to enter the medical field, either because they have a background in the healthcare field or looking for a new pathway, is the barrier around English language acquisition. So this new apprenticeship program is one of the pathways to enter and to be able to build some of that English language skills. There was a question in the chat if any of the other programs incorporate ESL or can work with a limited language learner, English language learners.
Yeah, that is a great question. There is a program right now that they are piloting at Primary Children's Hospital, specifically to bring in individuals with potential lack of kind of clinical language skills, to be able to offer an ESL training program while they're working on the job, knowing that we will, get those strides with the English language. But so there is a pilot there. A lot of our entry-level roles at Intermountain don't have an English requirement, right? So you can come on the job and start working immediately without a need for a certain achievement of the English language. Natalie, with our upfront tuition benefit, there is Voxy, which we will be using as part of our program. And so Voxy will really allow the learner to continue learning. And it's not only English that it allows proficiency in, but there's multiple languages that Voxy addresses. So that's a really neat opportunity as well, because we also know that there's a great need for bilingual and multilingual employees at Intermountain. Intermountain does have their own training program and certification program for translators as well. So that's a really interesting opportunity. It allows caregivers in any role across the organization to be certified as a medical translator. And so there is incredible need within the healthcare industry to be able to translate to multiple languages, so that we are communicating patient care effectively. So I would say if language continues to be I wouldn't put language as a barrier to entry at Intermountain Health. It may be a bit of a challenge with some positions, but there's a lot of roles at Intermountain that don't have an English level proficiency as part of that minimum requirement.
I think I would add to the other thing that we hear so often is that people don't have a way to get their foot in the door, to build the networks or referral, any way that employment and job opportunities come through networking, right? And being able to build your career through relationships. And so these are really great opportunities to get your foot in the door, really try to build some of those relationships, show what you can do, what your healthcare background is, and then potentially be able to use some of that tuition assistance to take additional courses that you might need to recertify or recredential, as one example, or to do some further instruction around English language acquisition. A lot of times we see that the vocational ESL or that next advanced level ESL is through private companies or institutes of higher education where you have to pay for those courses. So this is really, really great. I love the learn and work model and ensuring that people are getting paid for their time during apprenticeship, which can be quite a big barrier as well. So thank you, Mandy. Any questions from the audience, from folks who are here? Let's see. I think there's one that just came in. How much tuition assistance do you provide?
Yeah, so tuition assistance reimbursement is $52.50 a year, so $5,250 a year. Same with upfront tuition payment as well, up to $5,250 per year.
That's great. That's very generous. So it allows you to do quite a bit of learning throughout the year as well.
Good. Yeah, and what we've done with a lot of our certifications online and also some of our more kind of four-year degree or graduate level degree pathways is that we've really made that tuition in line with the offering so that you can get through kind of at a great pace and be not stretching out your education for years, but it does align really, really well with the tuition benefit.
That's great. Thank you, Mandy. There's a couple questions around contact information. We'll make sure that that's included in our follow-up email, or feel free to put it into the chat. And of course, use this group as a resource. If you have new updates or announcements, feel free to share them with us and we can share them with the groups and in our channels as well. Okay, so the next presenter is Jonathan Milan from IsoMed. And he's going to share a little bit about a pathway that they've developed for internationally trained nurses. So Jonathan, I'll hand the time over to you.
Thanks, Natalie. Appreciate it. And Mandy, Samantha, thanks for all that you shared today too. Looks like Mandy and I are working on a lot of the same problems to help address the healthcare shortages that we see across the whole ecosystem. So the fun part about that is helping tackle this problem with these new Americans here in the US already, and giving great opportunities to those that are here. So let me share this screen real quick. We're able to see that. Perfect. Well, like Natalie said, I am with IsoTalent. IsoTalent is it's a recruiting firm here in Utah that helps companies identify and find the right talent throughout the world. We've specialized in tech and other areas for the last 7 years of our existence. About a year ago, we finally threw our hands in the air and said, man, every day we're turning away requests for nurses. There is such a need for nurses here in the United States. And every time we've said, no, we don't do nurses. We don't help find nurses. We don't get into that business. About a year ago, we said, all right, the need is there. We need to help more. Let's go see what we can learn. There's a lot to learn. There's a lot to learn, and a lot of pieces that we've been working on with the state of Utah, with hospitals and facilities, all the way across the board to roll out IsoMed and to start to help not only individuals outside of the United States, but individuals already inside of the United States become certified as a nurse to be able to work here in the United States. So I'll talk through just a couple of pieces of that in the IsoMed model and how we're going about it here today. But as some of you may be aware, just some statistics on this, but the nursing shortage is expected to continue to rise. We're somewhere in need of 200 to 400,000 nurses, and that is expected to increase all the way through 2030. Different areas of the country are experiencing different shortages, but COVID really exacerbated this problem. This obviously allowed us to introduce IsoMed and bring an opportunity for these individuals to become nurses in the United States. You can see our website either off of isotalent.com or join isomed.com. I'll show that here later as we go, but it allowed us to really look at the nursing population differently and see how could we attack the problem by identifying individuals that, again, are already in the United States that are qualified from their home country. What's the pathway to allow them to become a nurse here in the United States? Or where are those individuals who have a desire to legally migrate to the United States and become a nurse here? And that's the problem we've started to attack. So our model it's different. It's as we talk to clients, it's different than anything they've ever seen. But we wrap our arms around the nurse from the very, very beginning. There's multiple steps, and I'll talk through those here in a second, but we help them through the process to become licensed as a nurse. We help them through the visa process. And then once they're here, we continue to help them and wrap them through all the way through the end of their time with IsoMed. So their very first day in country, step number 1 is we go help them get a cell phone. Step number 2 is we go get a social security number. Step number 3, step number 4, I mean, their first 3 days are completely mapped out so that we have licensed nurses with social security numbers in a new apartment or home, or most of the time, obviously a rental coming in just from the country, but walking into a role usually as quickly as day 4 to start to enter into the workforce and give back. It's a different model because it's from the very beginning, working them all the way through the process, all the way through, hey, you've worked here a year, it's time to pay taxes as we do it here in the United States. How do we go about that? That's our job. That's what we do as IsoMed, and help these people not only relocate, migrate into a new country, but be successfully entering into the workforce all the way through. It's interesting as we started to look at the map and understand, these are just my scribbles. I'm obviously not a graphic designer, but as we started to understand where are a lot of these people coming from, which countries are they coming from, why is the desire there? The most interesting conversation we've had out of all this, and I don't say this because she's here already, but Natalie was really quick to point out and say, there's already hundreds of these people here in Utah ready to work. They need some help. They need to get through the process, or the process is very complicated. How do we simplify this for them? How can we reach out? And that's of great interest to us. How do we help the individuals that are already here? We have, a couple of people that we're helping already. One of them is working at cleaning houses at night, giving back in any way that they can to earn a living for their family, which is fantastic. But they're a nurse. They are a registered nurse in their home country. Let's help them use the education that they have from their country to be able to be a registered nurse as they desire to here in the United States. That's our goal. That's our goal from anywhere in the world. Now, this is really hard. It's a big problem. And why is it so hard? We flash this number around quite a bit. There are 49 steps through the process, some bigger than others, to become licensed in the United States to become a nurse as a foreign educated individual. Those 49 steps, some of them are jumping through government hoops. Some of them are as simple as uploading your passport. Everywhere in between, though, taking the NCLEX exam, the same exam that we ask all of our nurses to take here in the United States, needs to be passed by those that are foreign educated also. And right off the bat, there's 4 different pieces to the test. Every nurse we've ever talked to can pass 50% of that test. And then the other 50% of the test is brand new information that they've never seen before, and they have to learn and understand better. That's hard. It's a hard process to understand and learn and go through, especially when it's usually as your second language. The NCLEX exam has to be administered in English. And so that's one of the steps we go through. So leading these individuals, highly qualified, highly educated, highly intelligent individuals through these 49 steps is half of our job. It's the first half as we move them forward. Now, here's a really, really simplified breakdown of the process. Step number 1 is they have to demonstrate English proficiency, which again, we've talked about a little today. It's not easy for everybody. So how do we help them become proficient enough to pass one of the 5 English tests that are available to move forward? Then is an education and license verification that they have to go back into their home country, grab the information from their school or their licensing agency and understand and make sure that it's equivalent for the United States. Then the NCLEX that we talked about, the visa process, and then the relocation process. Some simpler steps than others. Some, the education and license verification, typically, we think that should be a very simple process. That has been the longest pole in the tent and can take anywhere from 4 to 6 months. Now, again, the state of Utah has been great to work with, and we're super, super excited to be looking at alternative options and implementing new policy from a statewide perspective to hopefully simplify that process a little bit, which is really exciting. But this process can take anywhere from 3 months, depending on their English proficiency at the beginning, all the way forward to, 6-9 months as they continue to move forward. But lots of different areas in multiple countries bring different variables to it. Now, one of the interesting pieces is, as IsoTalent, there's a lot of pieces here. There's a lot of stuff to figure out, to keep track of. And so we've introduced some software just to help you walk through the process. What's the first step? What's the next step? Let's be transparent on our side as you're being, helpful on your side, and upload the documents into the same spot. And we found that this is really, really helpful for the individual so that they can see, what are my 49 steps? What do I need to complete next? Where am I at in the process? We call it our pizza tracker up here at the top, showing, hey, this is 50% complete. Like that's exciting for individuals as they continue to knock off more and more and more and see themselves get closer to the end. But this transparent process is super helpful for them. The other piece that's really fun is adding the communication behind it, whether we're communicating via email, via WhatsApp, via text message, phone call, etc. All of that can be done in the software that we've created to help these individuals move through this process. Believe it or not, we don't all communicate the same. And so while here in the United States, we send each other a lot of emails, we found that in Mexico, email is not as used as much, or the Philippines, it's not as used as much. So where WhatsApp is in one area and Facebook Messenger is in another area, we try to meet the individual where they're at. Use our bilingual recruiters that we have on staff to reach out and communicate as needed and help through the process wherever possible. We feel like the opportunity here is great for every one of these individuals that are willing to put in the effort and move forward on it. There's work visa sponsorship available to the individual if they're outside of the country and need that. If they're in the country here already and have an opportunity here as a new American, then obviously visa sponsorship wouldn't be as necessary. Our minimum pay rate for these nurses is $30 an hour, which in a lot of areas is a massive upgrade from where they're at right now. It's minimum though, because we talk about we have opportunities all throughout the United States. And so if there's a nurse that wants to go up and enjoy Alaska, there's a pay differential there. And there's all kinds of fun experiences and snow and fishing and all the pieces that comes with living in Alaska that's open to them. But also the opportunity for relocation help, identifying an apartment, identifying how to go buy groceries in the United States, how to secure a loan as you walk into a new country, get in a social security number, a bank account, etc. All of that where we're their guide to help them as they migrate into the country and figure these pieces out. Our locations extend. We have locations here in Utah, and we have locations all throughout the United States. We are fairly location agnostic and work with the nurse quite a bit as to what their preference would be. Again, Alaska is one that doesn't come up very often, but Texas and Arizona tend to be ones that are very, very interesting to our Mexican individuals. But the locations continue to expand, and we continue to try to work with those individuals as much as possible. Our IsoMed commitment, we talk about this often because, again, this has been an area where we're not new to the space. This has been going on for a very long time, but there have also been some interesting players in the space that have, I'll say, taken advantage of individuals. And we want to make sure that we're really, really clear about that from the very beginning, that number one, our job is to help you maximize your earnings and benefits. We don't take any of these individuals' salary as they come up here. The hospitals or the facilities that we place these people at are where we get our payment from. So there is no piece that we're taking from nurses and sharing that money as it comes. The other piece is that we're really, really aggressive on the visa side. The TN visa is a great visa for Canada and for Mexico, but the biggest downfall with it is if mom, let's say, comes in as a nurse and brings her family up here, which is all great, it doesn't allow dad to legally get a job in the United States. So it's a fantastic visa. The acceptance rate's really high. It's really clear what can and can't be used for it, but keeping the family together is super important, but also allowing mom and dad to be able to work if they want to is a massive, massive miss if we're using the wrong visa. So we've been really, really aggressive on our visa structure, identifying the right visas so that both mom and dad can come up as a family. And actually the visa that we typically use allows individuals 21 and under to also work under that sponsored visa. So it is a family commitment, a family relocation where we try to bring everyone together and not break apart families, but give opportunities to be family first together and always. And then lastly is following the law. That's super important to us, as obviously we talked about day one is the Social Security number. We don't allow our nurses to move through the process without making sure that the license is verified, the education is verified, but then also once they get here to make sure that they're legally here, that they move through with the visa, that we get the Social Security number and move forward in the right way. So immigration's a hot topic. It will always be a hot topic. Legal immigration should never be a hot topic because these are individuals who are looking to fill openings that we have that we're in desperate need to fill throughout the United States. So we're excited to continue to partner and work with groups that are interested. Now, joinisomed.com is our website here. I will say one other piece. We're very close. I wish this webinar was like 3 days later, but I'll slightly let the cat out of the bag and overpromise and hope that we pull through on this. But we've been working with the state of Utah on one massive change, and we're really, really excited about it. But in a lot of countries, there are individuals that become doctors. And becoming a doctor here in the United States is a long, arduous process. I would say nearly impossible to become a doctor again. You've got to go back through schooling boards, et cetera, which is really hard to do, especially as an immigrant. Now, we've met numerous people that have done that, and we fully support that. But if that isn't an option right away, or if it's something you need to work into, we've been making the case to the state of Utah to say, why wouldn't we want to allow these individuals to go through the right education piece to pass the NCLEX and become nurses? I understand that they're educated differently, but they have a desire to be in healthcare. They have a healthcare background. Many times in these countries, the doctors are the ones actually teaching the nurse classes. So could we look at that? I honestly believe we're 2 days away from being able to iron out that process and start that certification process. They'll still need to pass the NCLEX. They'll still need to work through this full nursing process. But these people are highly qualified, over the moon to be able to come back and give back in the healthcare profession that they love so much, that this will allow them, even if they do want to become a doctor, a step to becoming, a higher learning or living wage as they make that transition back. So we talk a lot about nurses and IsoMed. Originally, frankly, we founded the company as IsoNurse, and we said, no, that's not right. Let's broaden our scope. There's opportunity here to help more people. So IsoMed is excited to help these individuals, not only in Utah, but throughout the United States and throughout the world, to continue to find their pathway to help give back to the healthcare profession here in the United States.
Thank you so much, Jonathan. Really excited to see how this kind of process unfolds for those with the healthcare background, especially MDs and others in the state of Utah, and get people back to work in their trained professions. I think one of the things that has resonated with me so much is we've been kind of peeling back the onion and really understanding who internationally trained professionals are in Utah is a commitment to serving their community. And people just really want to be able to put that education, that background to use to serve. And that's part of the ethos of the state of Utah. And so there's certainly a marrying of values that comes along with that too. There was one question in the chat from Randy, and just wanted to hone in on this a little bit more. She was asking, is there a charge for this service? If you want to just speak to that for a second. I know you touched on it, but just clarify.
Yeah, there is no charge for this service. IsoMed does ask for a commitment upfront from the nurse to work with us, I should say, for 2 years. And it is a 2-year commitment, but upfront, IsoMed bears all of the costs. So there would be no costs to the individual to move through the process. And because we're helping with the visa, we've gone to a lot of clients, hospitals, et cetera. And a lot of times we get the answer of, we're not visa experts. Visas are hard. There's a lot of legwork to them. And if we're doing a lot of them on our side, we get kind of good at them. So we take on all of that process. We help through the visa process. We help through the licensing process. We do that for the nurse and for that individual. And during that process, we bear all of the cost. In return for that, we ask that they continue to work with us for at least 2 years after that. Now, our hope is that they really like to work with us, and they really like being here in Utah, and they really like the arrangement that we've all given them as a community, and they want to stay for as long as possible. Again, bringing that family here allows them to set some roots that is super important to us.
Thank you. Are there any other questions from the participants here? You can either raise your hands, we can take you off of, pull you into the conversation if you'd like to talk. Feel free to let us know. And if not, I have some questions for the audience too, to just engage in a little bit of two-way conversation around these pathways, and just getting a little bit of a better idea about what resonates with you about these pathways. How do we better inform new Americans about these opportunities? What are some of the potential challenges or hiccups that you see from the three kind of presenters that we had? Great. Let's see. We had one raised hand, and did I invite you to speak? Let me see. Oh, there we go. Go ahead, Aaron.
Hello, guys. How you doing? So I got late into this meeting, but I belong to an organization called United Physicians from Venezuela. So we are in that organization right now, 93 doctors from Venezuela, trained doctors in different areas. So this is my question. Is there a way that this organization called joining IsoMed can help us to enter to the health field? Is there a way that to get that help for us to enter to the health field here in Utah?
Yes, there is a way, and
that is my question. Yeah.
Oh, sorry about that, Iran. Yes, there is a way.
No. That is my question. Yeah. Can you?
Perfect. Yes, there is a way. If you want to reach out to me via email, I put my email in the chat, and I know that Natalie will send it out after this meeting. But we would love to help any and every one of those doctors. And the hard part is, I can say yes, we can reach out and help, but every single situation is different. What visa are they here on? What is their background? What is their experience? And lots of different hoops and pieces that we need to talk through. And frankly, I think every one of those 93 doctors have different stories behind them and different opportunities. So we'd love to help. We'd love to speak with you or those individuals and see how we can help them. Especially if they're already here in Utah. We've checked off the visa box. We're 20%
we are
way through
all
the
here
process already. So we'd love to do that. And frankly, if we want to pull a meeting together with all 93 and explain the process a little bit deeper, we'd be happy to do that.
Okay, thank you so much.
Thank you, Iran. I think that two-way communication is so important for IH, for IsoMed, for other businesses and industries that are really trying to build out these programs to better understand how they can work with a new American population in Utah. So Jonathan's program is very much structured around recruiting international talent, but they are really looking at what they can do to really better that that pathway, or to smooth that pathway for people who are here as well. So thank you for your comment, Yuran. I know that they would appreciate engaging and learning a little bit more about the Venezuelan the Utah Medicos de Venezuela. I know we've met before, and I think it'd be very beneficial. Are there any?
Sorry, just to add to that, that's one of the hardest things that we're trying to do, is simply identify the candidates, identify the individuals, and especially where they're here already. I wish we could stand up on one of these really tall mountains that we have and say, hey, we're looking for you. We want to help, because that's what we're positioned to do.
Yeah. Well, this is a small hill that you help with. So are there any other comments or questions or reflections back on what you heard today?
Nellie, there was a question about DACA students, and wondering if how some of those programs would be able to expand to DACA students, and some of the status changes that might happen
Yeah,
in the near future, and wondering if any of the speakers could speak to that.
Mandy or Jonathan, have you explored kind of DACA recipients as a talent pool for your pipeline?
I am not in talent acquisition or sourcing team, so I'm not sure if Intermountain as a whole has explored that. I know for apprenticeship that probably hasn't been a targeted audience, but I would love to investigate that further and kind of do more of a deep dive to explore that opportunity.
That would be great.
Yeah, I know specifically for IsoMed, Gabriela, it's good to see you and good to see your name, but we have not reached out to those individuals yet. This is kind of our first step into a reach out here locally, and we'll continue to work out. We've talked with the Hispanic Chamber of Commerce and other areas as we begin to reach out into the population here in Utah. But if we'd love to speak to them if there's a contact, or obviously we'll start researching that ourselves.
Yeah. A lot of the universities have a dream center or something like that. That would be a great kind of contact to begin with, to learn a little bit more about the immigrant students who are either dreamers or DACA recipients themselves. So I can help you with that if anyone's interested in kind of connecting with those institutions, or on the chat, if you're associated with them, please put your information in the chat so Jonathan and Mindy can follow up. Let's see, there's one more question on apprentices. How many apprentices do you take per year? What have you learned from going through this process?
Oh, that's a great question. In 2023, we had 115 apprentices. That number will vary as we expand and open programs, or we reevaluate and probably close some programs. So it's in a state of flux, but we do have an anticipated growth rate within our apprenticeship programs as a way to train, develop, and grow our own workforce. So I can only see that growing from that 115 number every year. What did we learn going through this process? Oh, so much. As really new individuals, as a new organization to apprenticeship, it's been a really wonderful opportunity to learn best practice from other organizations, from organizations, from training intermediaries, from our local state apprenticeship offices, from the Department of Labor. So really capturing on best practices learned, and then being able to grow from our own program. So one of the things that we've truly identified, and I love that Jonathan is implementing this, is this full wraparound kind of support structure. We do know, and we both kind of from anecdotal, but also from proven research, that folks and individuals are a lot more successful when there's a support structure in place. So any way that we can help champion that in our programs, we really do implement that along the way. And we have shown great success when we have those models in place. So not only is it a proven model, but now we're implementing kind of proven strategy around support structures and having those in place for all of our program attendees.
Great, thank you, Mandy. Let's see, there was another question in the chat here for all the presenters. How are these programs being advertised? Is it difficult getting the word out and getting individuals connected?
I will just say we have not had a problem getting the word out. A lot of our opportunities when they come available are offered on our external facing career page. And from that page, a community member can actually put in search parameters and have notifications for when these jobs become available. Through the Return to Work program, we'll be working with Natalie and her team to communicate these opportunities outward to the community. I'll just give you a quick idea of response. Our last cohort, or our very first cohort that we implemented for our surgical technologist program, before the program was even posted and implemented and ready to go, we had over 128 individuals who reached out with interest about the program. From that point on, the position was formally posted on our careers page. We had 98 applicants, 50 individuals were interviewed, and we offered 15 positions. So I think the concept of this learn and earn model and being paid from day one is obviously very attractive. So we haven't had problems getting interested candidates. What I would like to see, though, is the ability to connect with our community partners to be able to advertise with the various clientele that they serve.
Thank you, Mandy. Jonathan, did you want to add anything to that?
No, I think what Mandy said was great. I think word of mouth is obviously, continuing to grow, and there's a lot of opportunity for that. What we found is when we identify one individual and speak with them, we'll usually talk with 3 more if we treat them right. I think that's been the best advertisement that we've seen is as we give back and as we do work the right way, people, tend to bring their friends, and that's exciting. So we're advertising in a lot of different ways, but that's been obviously the most effective one.
Thank you. I really want to hone in on that customer experience or that potential employee experience from the moment somebody meets, walks into the door or submits an application. That says a lot about how somebody will be treated. I'm specifically lifted up these 2 organizations because of my interaction with them and really wanting to highlight, the value add that they see for their company and organization, but the interest in the individual and the human and family and kind of seeing people as holistic individuals and not just workers that are going to fill labor shortages. That's a really important tenet here. And so thank you for pulling that up, Jonathan, and thank you both for that work. We'll take a couple more questions before we wrap up. Shane had a question here, and he posted in the chat as well. What was the business case or major benefit to your companies for seeking out a talent pool outside of the United States? I think this would be for Jonathan specifically. So yeah, go ahead.
Yeah, there's a lot of different areas to talk about on this one. I think the biggest one is, and I think actually Mandy's way more qualified on this than I am to talk about it, but fundamentally speaking, I don't think we have enough nurses that want to be nurses in the United States to meet the demand. It's a demand issue. It's a labor issue. And so once we're done picking up nurses and moving them from hospital to hospital and rearranging them and paying large signing bonuses to rearrange new nurses to the right hospitals, and we look around and we say, we still need new nurses here in the US. And so schools are educating and schools are moving nurses into the population. But the research that we've done is this will continue to get worse unless addressed in a more creative manner. And so one of those creative manners is how do we, grab those immigrants that have a desire to be here, move them through a qualified process and help them relocate on a legal non-immigrant status. That's the business case. Now, as we go out and we look at demand from hospitals and facilities, and we look at demand from nurses, it's massive on both sides. And so the commitment to that labor pool kind of speaks for itself, where everyone stands up and says, please me. But it's a very complicated process to work through. And so kind of building that bridge between the two, it sounds really nice because you have demand on both sides, but gosh dang, it's hard.
It is incredibly difficult. I will say that that is one of the pieces of work that the Utah Immigration Center is working through. That's why we're trying to build all of these bridges together and pull the resources as much as we can. I'm going to share in the chat a piece that came out last month from the Bipartisan Policy Center that talks about the importance of immigration with the changing demographics within the United States. That's very applicable to changing demographics within the state of Utah. Very important. If you need any reason to make the case to industry or to employers or to other organizations, this really kind of highlights a lot of those elements. It's a good read and a good podcast to listen to. We'll take the 2 more questions from folks who have their hands up. Ingrid, if you want to go ahead and ask your question. You can take yourself off mute. Are you there, Ingrid?
Okay, hi.
Hi.
Hi, Natalie. Thank you for this opportunity. And only I need a question. Is possible check the new law that start in California, that this law permit the doctors, Mexican doctor work only need take one test and check the different authority of the health in this state and start right now in Latin clinic. Is possible check this similar opportunity for our 97 doctor, Venezuelan doctor in Utah in this moment?
That's certainly something to look into. I know our colleagues at the Department of Commerce are consistently looking at the different policies that they can update and revise and help create a smoother path for all professions. There's a couple people on this call from the Department of Commerce, but we'll take note of that. And I'm not familiar with that legislation specifically for doctors from Mexico, in California, but I've heard about other legislation from other states for internationally trained medical professionals. But I will definitely look into that, Ingrid, and relay that to our Department of Commerce colleagues.
Okay.
Thank you.
Thank you. Thank you.
And then was there one more? Iran, did you have something else you wanted to say, or is that your hand up from before? Okay. Well, we'll go ahead and move on and kind of close this out. Thank you so much to everybody for participating today. If you want to advance to the last slide, there's our contact information is available on the slide there. And feel free to reach out to me or to Z if you have more information that you'd like, if we could be of assistance in any way to helping kind of bridge industry business with immigrant communities, ideas, feedback, whatever it is. That's really the charge of the New American Task Force, is to be that bridge and to take insight from you all and to better inform our policies and practices within the state of Utah around immigrants. Our next meeting will be November 9th. The topic is coming soon. I'm hoping it will be around advanced manufacturing. We'll keep an eye on that. And if not, we will have another very engaging topic, potentially around digital access and digital inclusion. Please, before you leave, there is a QR code to register, to submit a form for the New Americans Task Force. These webinars are open to everybody. We have a lot of interest about these information and resources, but as a member of the task force, we invite you to events, share updates from the state of Utah directly with you around immigration, uplift some of the latest that we're hearing nationally around federal immigration policy, or like the reports that we just shared here, to really help people stay informed around New Americans in Utah. So please hop on there, click the link and submit your information so you can be a member. And of course, you're always welcome to join us for these calls as well. So with that, again, thank you to our panelists and to everybody who joined us today. And we will be sharing the slide deck. We will be sharing the contact information for our presenters. And again, we're open for feedback anytime, so please share that. Thank you, everyone. Have a wonderful day.